I'm honored to introduce the new procedure, spinal epidural balloon decompression and adhesiolysis using genu catheter. I'm Jinu Xian. I'm a professor in the Department of Anesthesiology and Pain Medicine at Seoul Asan Medical Center, Ulsan University in Korea. Asan Medical Center is Korea's largest hospital with about 3,000 beds. I developed the world's first two interventional procedures. One is spinal epidural balloon decompression and adhesiolysis. Another is genicular nerve radiofrequency ablation for patients with chronic knee pain. There are two kinds of conventional adhesiolysis and neuroplasty. One is chemical neuroplasty using wedge catheter, and another is mechanical adhesiolysis using navicatheter or the epidural scope. However, both methods didn't have satisfactory results because they cannot remove the adhesion effectively, and they cannot alleviate the stenosis itself. The balloon procedure was developed to supplement the disadvantages of the pre-existing procedure. The following clinical trials were conducted to assess the effectiveness of the balloon procedure. This study on transforaminal balloon decompression was conducted as a randomized controlled double-blind clinical trial and published in the journal Pain Physician in 2013. Inclusion criteria were the patient with unilateral, intractable unilateral foraminal stenosis. I randomly assigned the patients into two groups. With the balloon group, I inserted the balloon catheter into the intervertebral foramen and performed the balloon decompression. With the same group, even if I inserted the balloon catheter into the intervertebral foramen, but I did not inflate the balloon. The needle was inserted in a similar way as the transforaminal epidural block. Then the balloon catheter was inserted through the needle. From this point to here is the area of the intervertebral foramen. Decompression was achieved through reparative ballooning and deballooning while slowly withdrawing the catheter. Here are the diagrams of the research. Leg pain, back pain, ODI, and claudication significantly improved over the 3 to 4 months in the balloon group compared to the sham. Significant improvement in claudication led to higher levels of patient satisfaction. 1 year after the procedure, about 20% of the patients in the balloon group showed more than 50% of pain relief, whereas none has been recorded in the sham group. To confirm whether these improvements were actually made through the dilation of the marginal stenotic area, and if so, how much it actually dilates, I injected contrast dye transforaminally before and after the balloon decompression and reconstructed the spread pattern into a 3D image. From this point to here is the area of intervertebral foramen. Left image shows the before the procedure. Right image shows the after the procedure. Spreading diameter of the contrast dye in the intervertebral foramen increased by about 28% after the balloon decompression. Spreading volume of the contrast dye in the entire intervertebral foramen increased by about 98% after the balloon decompression, almost doubled. In view of this research, it can be thoroughly said that balloon decompression can expand the marginal stenotic area. There are 3 kinds of balloon procedure: coral approach, transforaminal approach, and interlaminar approach. This is the genu catheter for the caudal approach. This is the GNUF series catheters for the transforaminal and interlaminar approach. Let me introduce the caudal approach using GNU catheter. This is the video showing the overall procedure of the caudal approach. After skin preparation, remove the inside air of the catheter. Check the balloon. Connect the balloon syringe filled with contrast dye, like this. After local anesthesia, insert a needle into the caudal epidural space. The needle has to be placed parallel to the caudal epidural space. Inject the mixed solution of lidocaine and contrast dye to perform the regional anesthesia and epidurogram at the same time. Patient has a filling defect in right L5 foraminal area. This is a pathology lesion. Insert the catheter through the needle. Advance and adjust the catheter tip to the right L5 foramen, the pathology lesion. Sometimes using the balloon. After fully inserting the catheter like this, perform the balloon decompression while ballooning and deballooning. Repeat 2 to 3 times. After that, inject the contrast media and confirm the dye spread to the filling defect area like this. After that, inject the treatment drug and navigate to other pathological lesion and perform the balloon procedure in a similar way. There are some points to consider when ballooning. Stop ballooning when patient complains of severe pain. Do not keep the balloon inflated for more than 5 seconds. Move the catheter in a deflated state only, especially in the intervertebral foramen. By using the balloon function, you can remove a broader region area and alleviate the stenosis directly. So balloon procedure can further improve the effectiveness and reduce the recurrence rate. If you need, you can insert the epidural scope through the GNU catheter, and you can also perform neuroplasty at the same time using hypertonic saline. When it comes to the target size for the procedure, if the patient has a symptom of L5 radiculopathy, the pathology lesion is likely to be the L4 fibrillary discal area for L5 traversing nerve and L5 foramen for L5 HT nerve. In this case, I recommend performing the procedure on both L4 fibrillary discal area and L5 foramen. If the patient has a symptom of S1 radiculopathy or back pain, I recommend performing the procedure on central area only. Epidural space is divided into 2 parts. This line shows the anterior epidural space. This line shows the posterior epidural space. If you perform in the central area, I recommend to perform the procedure on both sides of the anterior and posterior epidural space. This is a hypothesis on how to relieve the compressed nerve in the retrodiscal area using the balloon. When the nerve is compressed by herniated disc like this, insert the balloon catheter just lateral side of the compressed nerve. Red is balloon catheter. In this state, if you inflate the balloon like this, compressed nerve will be pushed inward and relieved by the balloon. This is a clinical example. The right S1 nerve is compressed by the right L5 S1 disc protrusion. In this case, I inserted the catheter to the just lateral side of the compressed nerve. In other words, just medial side of the pedicle, and inflated the balloon to relieve the compressed nerve, like this. This is my technique how to relieve the compressed nerve in the lateral recess of the retrodiscal area. In the normal intervertebral foramen, nerve should move freely, like this. However, if there is stenosis, adhesion would be accompanied. Balloon expansion in the intervertebral foramen has the effect of not only alleviating stenosis, but also removing adhesion. This is a video showing inserting the catheter into the left L5 foramen. Advance and adjust the catheter tip to the left L5 foramen. After fully inserting the catheter, perform the balloon decompression while ballooning and deballooning. Repeat 2 to 3 times. After that, inject the contrast media and confirm dye spread to the foraminal area. Treatment area. After injecting the treatment drug, navigate to the left L45 retrodiscal area to relieve the L5 traversing nerve. Advance the catheter to just medial side of the pedicle like this. After fully inserting the catheter, perform the balloon procedure while ballooning and deballooning. After that, inject the contrast media and confirm dye spread to the treatment area, retrodiscal area. In the lateral view, so you can see dye spread to the anterior epidural space. If you perform in the center area, I recommend performing the procedure on both sides of the anterior and posterior epidural space. Catheter is in anterior epidural space, catheter is in posterior epidural space. You can see the difference. L4 fiber and L5S1 retrodiscal area are common sites occurring adhesion. Therefore, it is important to treat the retrodiscal area widely. This is a video showing how to remove adhesions in the L4 fiber retrodiscal area as wide as possible. Move the catheter tip from side to side in the retrodiscal area like this. You can perform the balloon procedure even in a patient who has undergone interbody fusion. In this case, you can perform the balloon procedure only in the anterior epidural space, not posterior epidural space. You cannot perform the balloon procedure in the posterior epidural space because of severe fibrotic change. For example, in this case, advance the catheter to the anterior epidural space like this and turn to the AP view. Advance the catheter carefully and slowly. sometimes using the balloon and hyaluronidase. Advance carefully. After fully inserting the catheter, you can perform the balloon procedure while slowly withdrawing the catheter in the ballooned state. You can adjust, you have to adjust the withdrawal speed according to the pain level. After that, inject the contrast media and conform dye spread to the filling defect area, treatment area. In the lateral view, you can see dye spread to the anterior epidural space. You can see the balloon moving in the anterior epidural space. Let me introduce the transforaminal approach using genu catheter. This procedure is suitable for single level and localized foraminal lesion. This is a video showing the overall procedure of a transforaminal approach. Insert the catheter in a similar way as transforaminal epidural block. Insert the catheter into the foramen. When the needle tip reaches the anterior epidural space, like this, turn to the AP view and insert the catheter through the needle. After fully inserting the catheter, perform the balloon decompression while ballooning and deballooning. Repeat 2 to 3 times. After that, inject the contrast media and conform dye spread to the foraminal area. If the patient does not complain of severe pain, it's good to inflate the balloon as large as possible. The larger the size of the expanded balloon, the better the effect. If the maximum oblique angle, you can insert a needle into the intervertebral foramen. In other words, this angle is less than 30 degrees. The transforaminal approach is not possible. You have to use interlaminar approach instead. There are two kinds of interlaminar approach: retrograde approach and the same level approach. Genu F03 catheter is suitable for the interlaminar approach. This image shows retrograde interlaminar approach. These images show same level interlaminar approach. The indications of balloon procedure are claudication or radiculopathy caused by stenosis, perineural or epidural adhesion, short duration less than 1 month to other conventional interventions, including epidural steroid injection, transforaminal epidural block, rods, or Levy catheter, or epidural scope, etc. Some people are concerned about nerve damage from balloon expansion. According to the review of the published journals, the balloon compression of less than 2 hours does not cause damage to the nerve. It is advised to expand the balloon for less than 5 seconds and to stop the ballooning if the patient complains of severe pain. By following these guidelines, nerve damage is unlikely to occur. Since balloon procedure using genu catheter was certified in Korea in 2013, it has been commonly used in most large and university hospitals. Genu catheter has obtained CE certification and is exporting to Singapore, Italy, Thailand, and Hong Kong, and Malaysia. I have more than 10,000 clinical balloon experiences so far and have had many cases of patients whose treatment effect lasted for more than 10 years. So far, total 18 SCI articles related to the balloon procedure have been published. Among them, this retrospective multicenter randomized retrospective multicenter study is also included. 3 department doctors in 7 hospitals in Korea involved. Anesthesiologists, neurosurgeons, orthopedic surgeons participated in this study. Total of 317 patients were enrolled in and published in the Journal of Clinical Medicine in 2019. I published the book that contains everything about the balloon procedure. Please refer to this book for more detailed procedures. You can buy this book on Amazon and Spring homepage. Our hospital, Seoul Asan Medical Center, is open anytime for attendees. Anyone wants to see or learn about the balloon procedure can come anytime. Welcome. Thank you for your attention.